Okay, let's get started. Welcome everyone. Thank you for tuning in to today's webinar that's hosted by the SDG2 Advocacy Hub and the United Nations World Food Programme. My name's Paul Newnham. I'm the CEO of the SDG2 Hub, and I'll be moderating today's discussion. Thank you to all of the people that have registered and joined. We've got almost 100 people and counting. And we're really excited to have you with us today. We want this webinar to be as interactive as possible, and so we're going to ask you to drop your name into the chat, where you're dialing in from. It's always good to see on these calls the different groups that are coming together from around the world and just the reach. It's obviously different times. I'm dialing in from Australia. It's almost coming towards midnight, so it's 11 p.m. We've got people that are just waking up and having coffee and getting into their day. So we would also love to see if you are able to put in what's your principal concern on food security and nutrition in the next 6 months. We'd love to just get a bit of a read on what are people most concerned about in the next 6 months around this issue of food security and nutrition. And we'll have hopefully some time for Q&A and interactivity as well as we go there. And it's great to see people from so many different locations, from across the UN, from NGOs, from government joining the call at the moment. We all know that there's a number of challenges. We've had donors slashing their overseas development assistance in recent months, which has cut some of the life-saving support and resilience building investments in communities across the globe. And 6 months on, we now have data that documents and quantifies the impact of these severe cuts. The humanitarian system is nearing collapse, and emergency nutrition programs are folding, and food rations are being slashed, and humanitarians are made to do less with less. This is making impossible choices. This is prioritizing shrinking support to the few, while acutely food insecure communities are left without the vital assistance that they need. Some of our interconnected and fragile supply chains that previously provided knowledge, expertise, essential medicine, food baskets are crumbling as lifelines disappear. And many of our humanitarian partners who are working with vulnerable communities on the front lines of worsening hunger and malnutrition are documenting this collapse in real time, and they're sounding the alarm. So ahead of next week's World Food Day, today's dialogue, A Lifeline at Risk, understands the impacts of some of the cuts to foreign assistance. It's the global launch of a new report from the World Food Programme estimating that as many as 13.7 million people could be pushed into emergency levels of acute food insecurity, or IPC4, as vital assistance in IPC3 areas are cut. We're going to hear from the International Rescue Committee regarding the shuttering of nutrition clinics that provided life-saving nutrition care to wasted children in Afghanistan, South Sudan, Nepal, Syria, and many more countries. And we know that for children, malnutrition is life-threatening, and if they survive it, it will affect their long-term physical, cognitive development, impacting their future health, education, and livelihoods. In this webinar, we also want to hear from you, participants around the globe. What challenges are you seeing? How are you pivoting your programs and advocacy in this shrinking aid environment? And what opportunities do you see for accelerated action to break the cycle of food and malnutrition crisis? How can we better be working together? And so we're going to hear from different experts, and we're going to open the floor for other additions and insights and reflections. So let's get into it. Great to see all of you here, and let's start to set the scene. And let me introduce Jean-Martin Beer, the Director of Food Security and Nutrition Analysis at the World Food Programme, who's going to present some of the key findings. He has over 20 years of experience in the United Nations and dedicated his career to combating hunger worldwide, most recently serving as the World Food Programme Country Director in Haiti and the Republic of Congo. So we'll have a few minutes for Q&A on the report as well. So there is a Q&A function that you'll see on the bottom. Please drop your questions in the Q&A function as we go. But over to you, Jean-Martin.
Paul, thank you for the welcome. And I'd like to thank you for burning the midnight oil over there in Australia. So let's get into some of the analysis we have. The report is called "A Lifeline at Risk." The reason why we thought we'd put together this report is because needs are very, very high in the food security arena. We know that over 300 million people are facing acute food insecurity. The last global report on food crisis put that number at 295 million. That's a substantial increase compared to the last pre-COVID year, where it was 135 million. So big increase in needs. These needs are still very high, and they're also getting more severe. We're facing a deepening crisis in terms of food security. The number of people who face the most severe needs, so this is what we call IPC5, catastrophic, life-threatening hunger, that's increased by a factor of 20 in the past 6 years. And we ended the year 2024 with 1.9 million people in IPC5, people facing catastrophic levels of food insecurity. And we've got two famines taking place, one in Sudan and the other in Gaza. So the indicators are telling us that global food insecurity is getting worse. It's a deepening crisis at the time that this funding crisis hits the humanitarian community. What we were trying to do with this study was address three main research questions. How have these shortfalls and this disconnect between available resources and need, how is that affecting WFP, people in need themselves, and also the countries and their economies? What we did was focus on 5 countries. You see them on the map: Haiti, Niger, Uganda, South Sudan, and Afghanistan. They provide a variety of contexts to learn from. And the idea was to put this information in one place and share it with the global humanitarian community. And again, thank you to the SDG2 Advocacy Hub for hosting us today. So this, what this slide also tells you is that we went back to monitoring data, to quantitative evidence we have from our monitoring systems in place in country. We complemented that with interviews of the key institutions intervening in this space, and also with key decision makers. The next slide captures some of the key findings we have. And Paul, you started us off by mentioning a key finding is that we estimate that there will be a substantial rise in the number of people facing emergency levels of hunger. And let's be very clear, there's a 5-point classification for food insecurity. It's called the IPC. Many of you are familiar with it, but phase 1 means normal, 2 stress, 3 is a crisis, 4 is an emergency, and 5 is a catastrophe. If enough people are in a catastrophe, that's called a famine after being reviewed by the Famine Review Committee. Well, what we're seeing is people being pushed into category 4, which is emergency. This is when you start seeing high levels of malnutrition. It's when additional mortality is observed. And so it's quite worrying to see that 13.7 million people could be pushed into category 4 as a result of cuts to international food assistance. Now, when we did the country studies, and that's a global number, we did these country studies, and that's where we picked up these impacts on WFP and our local partners. So in many cases, rations have been cut. The emblematic cases in Uganda, where 1 million refugees no longer receive assistance in 2025. Those who do continue receiving some assistance, it's at a very low level. It's about a ration that covers 22% of their assessed needs. The impact on WFP is also an operational impact. Responding to the most acute needs costs a lot of money. This might be obvious, but it introduces a major trade-off for country offices. Do you help a small number of people with very high needs, or a much larger people with the same budget, a much larger set of people at a lower set of needs? For example, you've got the airlifts that we do in South Sudan. That's something you've probably seen it on social media. The Antonov letting bags of food go. That's extremely expensive, and it's something that we probably can't do, and that's at risk as a result of these funding cuts if no new funding comes in. This is something that might stop if it's not funded. And the trade-off is, again, helping more people with a lower level of vulnerability. We're also seeing impacts on people and their food security. So clearly, we've got impacts on food consumption. In many other countries, you're seeing a reduction in food consumption indicators and in coping indicators. In the case of Afghanistan, there's an evident impact on admissions of malnourished children. We're already seeing an increase in admissions as a result of reductions in the coverage of the blanket supplementary feeding program. This is worrying, and it will probably get worse as these funding cuts feed through. One of the insights we have is that, yes, in some cases, the cuts have already taken place, but in other countries, they're feeding through the system, and they might get worse in 2026. So be on the lookout for more impacts in the future. We're also seeing an impact on resilience programs. Many humanitarian agencies have, such as WFP, we do emergency programs, but we also have a resilience component to what we do to address root causes. Now, in the case of Niger, it was clear that these cuts are having an effect on the resilience activities we had in the country. We were very focused on ensuring that vulnerable communities in Niger would reach a higher level of self-sufficiency and a higher level of resilience as a result of WFP programs. Well, these gains are under threat from these funding cuts. And we need to think beyond the humanitarian space. These cuts also have an impact on economies. In South Sudan, 25% of the GDP, it's official development assistance. And you take that away, you're asking for big problems in terms of inflation, currency, fiscal space. This is something we need to watch out for. And there are also impacts on the stability of the countries we work in. For instance, in Haiti, there's social unrest. The country was meant to organize an election, but at a time where the assistance is reducing, where funding cuts are reducing, we can understand how that could compromise some of those plans and the way ahead for Haiti. And I'll show you my last slide. We've got a few points for discussion, and I'd love to know what you think about these points. For us, in this funding constrained environment, we need to rethink many things. We need to focus on famine prevention. We need to advance famine prevention. And that's been something we've discussed in the past, but it really needs to be a much clearer focus for the community. In a sense, we spent many years rightly working on zero hunger, working on SDG 2, but with reduced resources, perhaps what we can realistically do is work on famine prevention, especially that there are two at the same time right now. Let's think about how we do that at the country level, at the international level, and how we advocate for famine prevention. It needs to be clearly articulated in specific plans in the countries that are at risk. We need to continue our political engagement for access to secure host government funding. That's a big factor, the whole question of host government funding at a time of reduced allocations from the international from international assistance. Let's think about how we do assistance during emergencies. We need to look at everything we can do to make these interventions more cost effective and perhaps work at the system level because, and this is the fourth point, in some cases, we're down to very, very small levels of assistance compared to the needs. You might wonder, and rightly wonder, is an intervention still effective if you're only addressing a sliver of the needs? Should we be thinking about specific coverage thresholds below which an intervention no longer makes sense? We're hearing about precision targeting of assistance, hyper-prioritizing assistance. That's actually very difficult to do. And it introduces questions about the acceptability of some of what we do. Does it make sense to help a small subset of people in an area where you've got a very large needs? We need to continue thinking long term. So as aid has been cut back, there's some operations might be tempted to, or some agencies might be tempted to focus on emergencies and not so much on resilience. But resilience does require a long-term vision and strategic investment, not retreat. The alignment to national priorities and local actors is probably one of the silver linings here. It means that we're seeing the humanitarian agencies and try to align as much as possible with national priorities in order to secure the host government funding. There's also the possibility and the opportunity of interacting with local actors, local programs. An interesting case is the Haitian diaspora. They send to their own country $3.6 billion every year. The humanitarian response plan for Haiti is $1 billion every year, and it's only 10% funded at the time we did the study, which meant that only about $90 million had come in. So again, $90 million versus $3.6 billion. Let's see how we can work strategically with groups like the diasporas, like the local communities to address the unmet needs. We need to safeguard information systems. So if we're talking about hyper prioritization, about precision targeting, you need data for that. But we're seeing less investments in information systems. And this could be the Achilles heel of an effort to redefine humanitarian assistance. And finally, we do need to advocate for all needs. Let's make sure we understand that there is at least in terms of food security, a global food crisis. The food insecurity levels are still at record levels with a deepening crisis with these very severe needs being out there. And we need to advocate for all of these needs, not just the ones we think we can fundraise for, so that people can understand and grasp the magnitude of the crisis. That's what I had for you. Perhaps back to you, Paul, and thank you for the opportunity.
Thank you, Jean-Martin, for these insights, and they're quite alarming to see. And I think for me, I'm always reminded when I see numbers like this of the individuals involved. It's sometimes easy for us to disconnect the numbers from the people, but this is families that are, fighting hard to try and feed their families, to work, find food, and there's challenging contexts. Those contexts have challenged for a whole range of reasons, and the numbers of 1.9 in IPC5, this funding shortfall, it creates a very challenging environment, and this is meaning that we're needing to shift, we're needing to adapt. But it's also meaning there's a lot of choice involved here, and that is meaning people are not getting what they need, and it's getting worse. And so we've got some time for clarifying questions. It's great. Thank you for everyone who's introduced themselves in the webinar chat, for the comments as well that are coming in. I see a question from Chris Leather in the Q&A. He said, can you clarify what you meant when you said we need to prioritize famine prevention and focus less on SDG 2 hunger reduction? He was just wanting you to clarify, did he capture what you said, or what were you saying there?
No, thanks, Paul. Of course, we all remain committed to a world without hunger. I mean, that has to be the objective, the long-term objective of us all. What we need to do now with limited resources is really focus on famine prevention, because that's something that we could probably have more of an impact on. That's a realistic goal for the community here with this limitation of resources, with the constrained resources we're now with. I think that's really the point. And when I've heard the term famine prevention a little bit more often in the past few years, and what I would like to do is challenge us to think about what that would mean. In operational terms, what does that mean at the country level? What does that mean at the community level to prevent famine? If we're able to prevent famines, I think that would be a win for us all in this environment.
Thank you. Can you just answer also just the 5 countries that you chose for this report? Why did you choose them?
We were looking for a variety. So you've got countries in different parts of the world. You've got different contexts. There's a refugee context in the case of Uganda. We looked at the conflict settings. Haiti's a setting with violence. Afghanistan, a very specific context that we felt fit in well for regional reasons, and also for because of it's just a very a country that always comes up in terms of the impact of funding cuts, because this is something that's happened on and off in Afghanistan for the past few years. So the idea was to learn as much as possible from the countries that were selected. South Sudan is always an example for us where there's actually quite a big focus on saving lives. So we thought by looking at this set of countries together, we would answer some of the key questions by having in the sample these different profiles there.
Thank you. Well, let's now that we've kind of got the context of the global figures, I want to kind of root this back in some of the country context, and I want to bring our panel of experts in as well. So I'm just going to introduce who we've got, and then we'll dive into the conversation. Please feel free to continue to add to the Q&A questions that come up through this, and we'll try and bring them in as we go. So we have, I'm going to start with Jeanette Bailey, the Global Practice Lead and Director of Research for Nutrition at the International Rescue Committee, or IRC, and who is also an adjunct assistant professor of population and family health at Columbia University. you've worked in the humanitarian field for over 20 years and also lead IRC's nutrition programs and research teams. And so, welcome to come here, also leading the movement against malnutrition to scale treatment of malnourished children globally. So, great to have you with us, Jeanette. We've got John Alif, who's started as WFP's country director for Afghanistan in May this year. And before this appointment, John served as WFP's regional emergency coordinator for the Sudan crisis in 2024. And prior to that, he was regional director for Asia and the Pacific, overseeing operations valued at over 3 billion and assisting close to 30 million people. So really critical experience that you're bringing in here, John. Welcome. And then we have Andrew Beckingham, is a seasoned senior public health advisor with over 17 years of experience in public health, nutrition, and pediatric care. And Andrew is the lead humanitarian nutrition advisor at Save the Children International, leading the humanitarian nutrition responses worldwide, and also serves as co-lead of the Global Nutrition Cluster Program team. Really great group to have here. Thank you for making the time. So let me dive in. John, as country director for Afghanistan, you really are on the front lines. You're seeing firsthand how a real shrinking operational budget directly translates into the number of lives saved, the resilience built within communities. And this is all at a time in the wake of a 6.0 magnitude earthquake. What are the top findings of the Afghanistan deep dive? And can you tell us a little bit about what does this mean as we go into winter, particularly in Afghanistan?
Oh, thanks, Paul. I mean, it will be no surprise to anyone on this call that acute hunger and malnutrition are soaring in Afghanistan this year. I think they're soaring in many places. But what this report helps us to understand better is actually the devastating impact which the aid cuts are having on the Afghan population. We're reeling here with multiple shocks. We've had the forced return of 2 million Afghans from neighboring countries. That's 2 million more mouths to feed, but also significantly, it's the lost remittances to some of the most vulnerable families in the country that is hitting and maybe biting even harder. We've got a serious drought affecting more than half of the country. We've had the earthquake in the east, which you referred to. But the critical shock, I think, is the dramatic reduction in food assistance and other forms of humanitarian assistance due to the funding cuts. At the moment, in the last few months, WFP, we've been turning away 9 out of 10 of the acutely hungry in the country. And in general, I can speak for all partners, we're facing rising needs, but do not have the means to respond. What the report in particular demonstrates is how cuts in food assistance are plunging more people into crisis or emergency levels of acute hunger, but also how cuts in food assistance have led to soaring acute malnutrition, which is threatening lives and overwhelming the health sector. Just there's a flood of people coming in that we just can't deal with. As WFP CD here in Afghanistan, there are 3 things that worry me the most. 3 things which the report, I think, does really well to bring into sharp relief. The first, as I mentioned, is a very rapid and alarming rise in acute malnutrition. We're seeing this year the highest surge in acute malnutrition ever recorded in Afghanistan. And we're having to turn people away, turn malnourished women and children away. I mean, that's just heartbreaking. Imagine the anguish of a mother who's walked 4 to 5 hours to the clinic with her listless and wasted child in her arms and finds it either closed due to aid cuts or out of stock because we simply don't have enough money. Malnutrition is going to be a really massive story and a big flashpoint in Afghanistan in the next weeks and months. Second thing I worry about is the extreme coping strategies, which, as the report says, have become normalized now for 90% of the households cut from assistance. To put some numbers on that, 25% of the households cut from WFP's programs have sent their children to work. Child labor is rising. Close to 10% have sent their daughters into early marriages. 6% have withdrawn their kids from school. And that again is not going in the right direction. It's actually getting more widespread, particularly as winter comes. Third thing I worry about, obviously, in this country is the impact on women and girls. They are already pushed to the margins of society, and now they are very clearly bearing the brunt of aid cuts. As you may know, it's illegal for women to work here. It's estimated 60% are inactive. Single females raising children is quite a large percentage of those. They're the most vulnerable of all. We've seen a rise in begging, a rise in desperation. And so very sadly, we've seen a rise in suicide calls from women to WFP's hotline. You talked, Paul, about bringing the human stories to this. Yesterday, a woman called our hotline, telling us she could no longer see any way forward but to take her own life. Hunger was decimating her family. Her husband was becoming more abusive as the family situation grew more desperate. And as we know, gender-based violence is quite prominent here. And tragically and heartbreakingly, they'd sold their 12-year-old daughter into marriage with a 40-year-old man from the community who was known to have a drug addiction, and they'd done so to get money to buy food. This is in a district where WFP was forced to cut its assistance a few months ago. These stories are not coming every day, but they are coming more regularly. Let me just say, these are the same women to which the world pledged unwavering solidarity and support in the wake of the takeover of the country in 2021. They're asking in 2025, where is that international solidarity now? Last thing, I mean, winter here is brutal. It's a flashpoint. Temperatures go down, needs go up. Even in a good year, winter is a flashpoint for hunger. It's a time when child mortality tragically peaks. For the first time in decades this year, there will be no significant international food response during winter. WFP's winter humanitarian food program is 8% funded, and we'll be turning away somewhere between 12 and 15 million people who will receive nothing during winter when the exposure and the hunger are the most deadly, if you forgive the term. We do fear unprecedented levels of child mortality this year, and I just fear that when the snows melt, we're going to get harrowing and heartbreaking stories, which will emerge from the communities that have become the victim of these cuts in foreign assistance. I'll stop there, Paul. Thank you again for the opportunity.
Thank you, John, to you and your team for the work that you're doing. And it's work that is never easy, but is at the moment made all that much harder. And we thank you for what you're doing. What stood out to me, the detail around the normalizing of coping strategies that bring kids out of school, that see child marriages, that see rising gender-based violence, also suicide. It's quite takes your breath away to understand the unintended consequences that are happening from these cuts. Turning away 9 out of 10 people, 8% funding. These are statistics that are hard to hear, and they really underline the importance of these reports for not reports to be sat with and listened to. And thank you. Jeanette, let me bring you in. The nutrition sector has seen devastating aid cuts this year, with analysis by Standing Together for Nutrition Consortium estimating a 44% cut in nutrition funding that's going to result in close to 370,000 or 369 additional child deaths, 1,000. Since January, you've led a global coalition of humanitarian nutrition partners working to keep life-saving programs open following some of the foreign aid cuts, documenting impacts at the community level. Can you tell us a little bit about what you're hearing from nutrition treatment programs on the ground and what you estimate the impact will be on child malnutrition?
Yeah, thank you, Paul. And John, that was really an incredible reporting from Afghanistan. I mean, the reality is that we are closing down life-saving programs. We've done our absolute best in the past year to band-aid situations with funding. And I think, at IRC, we've done a good job of maintaining as many life-saving programs as we could. But I don't think we expected that this was going to be the new reality that we would be faced with long term. So we really approached this kind of month by month in the initial parts, early parts of 2025. And I think now we're facing a new situation where this is becoming worse rather than better. So, to respond to what John said about Afghanistan, IRC had to close 10 life-saving feeding programs. And we know some of the families and the children who were severely malnourished and came to our clinics and couldn't access care. So everything John said, we know is true at IRC. And having led this global coalition for the past 8 or 9 months, we hear similar stories from other partners. I think we've all worked really hard, like I said, to find these kind of gap filling measures. And when it comes to, for example, to procurement of RUTF or therapeutic milks or RUSF, the global community has come together as much as possible to make sure those gaps are filled, but it's living in this chronic state of uncertainty. And we keep hearing from our nutrition managers in the field, whether they're in Afghanistan or Nigeria or Syria, certainly in Gaza, where they're looking at empty shelves, and they're not sure when is the supply coming in, and really, really living, week by week, that living with this uncertainty. And so I think what this does is it drives us backwards to a place several decades ago when all we could do was triage the most severely malnourished kids and reach them with the most inefficient, lowest coverage kind of care, which is, focusing in on our inpatient, our stabilization centers where the sickest of the sick are going. And, we did that in the early days after the executive order in January. We mapped out every single stabilization center we had at IRC. And then we did that as a global coalition because we knew those kids are sitting in beds. And if they're sent home, the majority will likely die very quickly. I mean, these are children who need IV fluids and antibiotics and 24-hour, round-the-clock care. So those children absolutely need our attention. Just as, Jean-Martin was saying about famine prevention, we do have to focus on those who are most at risk. But the problem with that is we are abandoning far more cost-effective solutions that could get ahead of the problem. And, the last couple decades has also shown us tremendous progress in the way that we have continued to shift and empower community health workers, for example, to deliver treatment in nutrition, simplifying our treatment protocols, empowering moms and dads to use the mid-upper arm circumference band and diagnose their own children with malnutrition and refer to community health workers. We have so many better strategies that would allow us to get ahead of things, making sure that we're treating moderate malnutrition so those kids are not deteriorating into severe malnutrition, getting ahead of moderate malnutrition with very effective, cost-effective prevention strategies, integrating with healthcare solutions and immunization, protection, and cash, contraception. There are so many different interventions that the more that we innovate, we integrate, we're going to see these cost efficiencies increasing. So what I think we're really worried about is at a time when aid money has gone down, the needs are rising, and the humanitarian organizations and the partners that have been investing a lot of resources in these more cost-effective community-based strategies to reach more children are being driven to focus in on the most basic and essential aspects of care, which will only be able to keep a fraction of the children in need alive. And I think that it's really important that we counter this narrative that, no child is going to die due to aid cuts. We've heard that in the United States. And here's my deep problem with that is when we have to close our programs, our therapeutic feeding programs, there's no one there to count the children who are being deprived of treatment and dying. So all we can do is use estimates and model the impact at various locations. And, the Standing Together for Nutrition Coalition did that as published in Nature in March. And IRC and our coalition partners have have continued to grow that analysis, looking at 37 countries, and we see something very similar to what they published in Nature in March. At least 300,000 additional deaths. Millions more children going without treatment. And now, to be very honest, this my gut feeling is this is an underestimate, because children aren't just losing access to life-saving nutrition care, they're losing access to immunization and supportive child health care and maternal child health care and so many other things that, a malnourished child is sick, and sick children often become malnourished. So this is all linked. So I think what we are dealing with is an inability to even show those numbers that would demonstrate the scope of what we're dealing with. And finally, I would say we know as a public health community that we can embrace innovation, we can rapidly change, and we can rapidly change the way we do things. COVID is an example of that. 5 years ago, the global public health community came together, and out of fear of this illness that was affecting everybody, in less than a year, managed to develop new vaccines and strategies to protect people. I think we've got a far worse crisis at hand that's going to kill millions of babies and toddlers under age 5 who haven't even had their lives start yet. They're going to be dying of hunger and basic preventable childhood illnesses. And so I think, when we get to that point in our discussion today, we really need to talk about what are the ways that we can come together as a community to drive that kind of innovation and rapid change that we saw during the COVID era. Thank you.
Thank you, Jeanette, for really talking and making this point of this chronic funding situation almost being a new normal for humanitarian partners, unfortunately. But also elevating the importance of integrating these community-based strategies that can prevent and break the cycle of crisis. I really like the way that you also had a positive note in there on what's possible when the community comes together and prioritizes an issue, and that the ability to pivot. And I think this is something, there's some. How do we do this in the situation that we're in is really challenging, because it's not just a small cut in funding, it's a major cut in funding, which is meaning you can't even count, you can't even be in certain communities because there is just such significant challenges. Let me go to you, Andrew, and bring you in, and I can also see a few questions starting to come in as well, and a few comments. So we'll try and bring them in as well. But Andrew, can you help us understand the cost of inaction on child malnutrition? The global nutrition clusters analyze the financing gap in humanitarian nutrition programs across 20 countries, and what is Save the Children seeing across these countries? And what does that data tell us for saving lives now, and if the current trends continue for 2026?
Great. Thanks, Paul. Hi, everyone. Just take the opportunity to thank the SDG4 Advocacy Hub and WFP, especially. I think the critical report that's just come out, I think, really demonstrates that really strong leadership in keeping food assistance and nutrition central to the humanitarian broader nutrition response agenda. And I'd just like to kind of recognize that kind of call for greater alignment between the humanitarian and development actors. I think it resonates deeply with what we're seeing at the cluster level. As Paul just mentioned, a few weeks ago, the UN General Assembly, the GNC, launched its financial gap analysis for 2025, or an update. There was an update. We did a financial gap analysis back in April, and then we've just re-updated those figures now for kind of September. So around May time, the GNC led a significant reprioritization of the reach of humanitarian nutrition in 20 countries, suffering from emergencies and kind of fragile settings. Across these 20 countries at the start of the year, through kind of the humanitarian kind of analysis systems that we operate, we identified 59 million people were identified as being in need of nutrition services. And through the cluster, the target at the start of the year was 42.3 million women and children for services. But due to the shifting funding landscape, we revised those targets all the way down to 27.9 million. That's just 42% of those in need. And this speaks to what was needed to focus on, those needs and the most critical needs. At Save the Children, we do believe, though, we need to go beyond family prevention. We need to drive towards cost effectiveness to maximize our reach and our coverage. And Jeanette, I think, spoke to that brilliantly. Millions of children at risk of being forgotten. And if we just keep a focus on Afghanistan from John, Save the Children have closed 21 mobile health clinics this year alone due to the cuts. And at Save, we're committed to continuing to push to re-establish as many of those clinics as we can, as well as many other services globally. Despite this painful reprioritization, as we move into the final quarter of 2025, there still remains a $473 million funding gap for humanitarian nutrition in just those 20 countries. This means humanitarian actors are being forced to make impossible decisions, deciding which children will receive treatment and which ones will not. Without additional resources, preventable child deaths are inevitable. And we've heard that from nearly everybody on this call so far. These aren't abstract figures. These cuts will translate into very real consequences for children and communities. So if we bring it back to a country, in Yemen, nearly half of the children are stunted or wasted, with 75 districts reporting critical levels of undernutrition. The reprioritization this year led to a drastic revision in the target from 7.8 million women and children to 2 million. Entire lifelines have collapsed. That's led to 377 outpatient therapeutic sites, 2,376 supplementary feeding sites, and 77 mobile teams in Yemen alone closing this year. As a result, that's nearly 450,000 women and children every month without access to care. So at the cluster, we're calling for donors to provide flexible front-loaded funding to close and stabilize these programs in 2025. We need more multi-year predictable financing going into 2026. We don't know yet the full impact of this, but even if we're conservative and say that we need the same as we needed this year, in those 20 countries, that's nearly $2 billion in funding. And yet we only have a tiny proportion of that committed so far, over 90% gaps. So this figure is only going to grow. And we've seen that from what everyone's kind of shared on this call so far. Yeah, I continue to welcome the report from WFP, this moment to continue raising the alarm, and we need to do it. There are too many artificial barriers in our system. Many of them come from 6-month funding windows, short-term extensions. They're not cost effective, they don't contribute to quality, and they lead to programs being shut. So pretty bleak overall on the finances as we come out of this, but we can do more. We can be more cost effective, and we've got to move. So in closing, I just want to thank the organizers, the panelists, and to challenge us all not to let 2026 be a year where we accept child deaths as inevitable. Instead, let's push to create the systems and the structures we need, including support to critical coordination mechanisms, including the GNC, SUN, and through government leadership to ensure that every child everywhere has the right to survive and to thrive. Thanks, Paul. Back to you.
Thank you, Andrew. Some really big numbers, but also that you brought down to that country level, 473 million funding gap for humanitarian nutrition programs in just 20 countries. Incredible numbers. And then what you were talking about in Yemen, 450,000 women and children without nutrition care. And think about that as a parent myself, something happens, you want to bring your child and go where you can get help. And to have that many people going looking for care and there being nothing or doors closed, what that must do to the parents, the desperation, all of the other consequences which start to unfold. Your call also, Andrew, for flexible funding that's more cost effective from donors as the real need for next year. You preempted my next question, really, which was around what are you asking for? So I guess as we're talking, in light of these feedback from WFP, IRC, the Global Coalition, the Global Nutrition Cluster, I'd like to just hear from others. What are you calling on? What are you asking decision makers to do now to save lives, but also to think about preventing future crises? Can I turn to you first, Jeanette?
Yes, thanks, Paul. I think a number of things. I mentioned this earlier. I think what we can do, and most of the people on this webinar appear to be from humanitarian organizations. I think that there is a reticence amongst everybody to really embrace innovation and doing things differently. So I think this comes in multiple ways. We have technical approaches that are innovative and different. Now more than ever, we need to be flexible and allow for different ways of addressing these challenges. In these contexts, but always something is better than nothing. And I would rather see us embrace public health approaches that reach as many children as possible, um, than hunker down and focus on delivering the perfect intervention to the few. So I think we really need to challenge the way, even the way we do things technically. We need to open our minds and embrace innovation. The other I mentioned was integration. I think we all recognize we tend to sit in our silos. We do this, I do this, focus on nutrition. I have colleagues at IRC who are working on cash and vouchers and climate change, and I have colleagues who are working on immunization, and we miss so many opportunities to sit down and draft proposals together, and we do that at the NGO and probably the UN level, but we need our donors as well to really push for that kind of integration, because again, where can we find cost efficiencies? It's standing on each other's foundations. And really, organizationally, we've talked about this a lot in our global coalition. So this is a third point. I mentioned innovation, I mentioned integration and partnership. We need all sorts of different partnership models. We need to work better together as a humanitarian community. I think the old way has tended to be one partner organization applies for funding in one location, and we have this kind of piecemeal approach across the country. And what we've tried to do in the coalition is really come together and say, can we build organizational efficiencies? Can we maybe share field offices? Can we share specialists? How can we put the government and local actors front and center and stand more in the back seat? I mean, all of these approaches would save money and put the real innovators, the ones who are in the communities, up front, because they're going to have far better solutions than we ever could, thinking, at HQ level. So I think those kinds of partnership models need to be embraced, but it can't just come from NGOs. It's got to also come from donors and UN agencies. And in terms of donor funding as well, I think we need better coalitions. I mean, there are other public health issues that have coalitions around them that fundraise together. We've seen the impact on HIV/AIDS or malaria or tuberculosis when global funding coalitions come together, and we need something like that for child malnutrition. We've been saying that for years. So I think there's a lot of different models that we could embrace. And then, finally, I would say we're not talking to the right people. I think we've got to bring in local leaders and community innovators. Somebody put in the Q&A about locally designed solutions. How do we elevate those solutions in our own work? So I'll stop there. Thank you.
Thank you, Jeanette. And I'm seeing lots of thumbs up and emojis that are agreeing with you there. Let's go to you, John. What are the urgent actions needed in Afghanistan now to save lives and avert some of the scenarios outlined in the report?
Thanks, Paul. I think the first thing I would call for is for decision makers to respect the commitments that their countries made repeatedly, I would say, to stand by Afghan women and to step in now in their hour of greatest need. Second, for Afghanistan, focus on winter and fund the food and nutrition programs, which will save lives and preserve the next generation. More globally, I really subscribe to what Jeanette said about, and it's very much the case here, it's a focus on prevention as opposed to just waiting until kids are in such a dire state. I think it's incumbent upon us to make better, more coherent, more joined up arguments and do more joined up coherent advocacy around this, but it is cheaper, as Jeanette said earlier, and it really is much more effective and involves much less human suffering, obviously. My last one is, I think, applies to Afghanistan, but also more broadly. It's recognizing that stepping up now is more than about just salvaging the world's humanity. And I don't want to sound too dramatic, but hell, we're really in a global crisis here of our humanity. But it's about more than just that. It's about also recognizing, because I feel that the humanity argument sadly only goes a certain distance at the moment. It's also about avoiding the migration and instability which short-term hunger tend to provoke, and that's certainly the case in many of the contexts that we've been discussing today. Thank you.
Thank you, John, and thank you for laying out so clearly what's needed there. Andrew, you've shared a little bit on this, but the Global Nutrition Cluster recently launched a statement of inaction with the Wasting Advocacy Coalition at UNGA. What does it call for?
Thanks, Paul. I think much of those calls to action have been made, and I think we've seen them in the real world from John, Jeanette, and some of what I've shared. But it's around, and I'll just copy them into the chat in a second. But there's a couple of other points that I just want to reflect on first, which is the prevention piece. We need to be better at targeting our prevention. We can no longer just say we need to prevent an entire community. We need to be able to use kind of the approaches that Jeanette was talking about, modeling and really understanding the data systems to really drive those greater returns on investment. So we need to focus upstream on children's homes. We need the services to be safe for mums, and they need to be accessible to women. And the services need to be close to homes. Nutrition is silent. It's not something that we see in the clinics. By the time you see a child in a clinic with malnutrition, you're already lost. You're so far behind the curve. It's not cost effective. We need to be upstream. We need to be seeing those silent children at home that need the services there and at that point. And all of the structural things around kind of financing that we can do to drive that has to be to facilitate those safe and appropriate services that are driven by a prevention lens to try and mitigate for as much of this crisis as possible. And just one thing that John said, and it links back to a question in the chat about, is there there's not a lack of awareness for decision makers, but governments are turning inwards. And I had a conversation recently with a journalist, and they were like, well, what's the story here? Like, what you're just presenting is the same story you told me 2 months ago. You're just putting bigger numbers and bigger numbers. And I was like, okay, well, we can be talking about 1 million childhood deaths. And they're like, the numbers are now too big. They're totally intangible. No one can visualize the crisis that we're telling. So when I was listening to John earlier, and he was telling that story of the woman phoning in, that was the story that really cut through. I work in this and I see these numbers every day. What does 500,000 women and children in Yemen not having access to services every month really look like? It's just a really big number. Whereas we have to be better at telling stories and bringing that humanity back into these stories. Because the numbers are just growing and growing. And if you go from one big number just to an even bigger number, it doesn't have greater impact. It feels like it should do, but big numbers and bigger numbers aren't where we're going to win this storytelling from. Thanks.
Thank you, Andrew. And I think this it goes a little bit to the question in the chat around the isolationism. I think we need different stories for really communicating some of this. And I think it's so critical for us to continue to bring that humanity in, but also to be able to really help people really visualize what does this mean. And I think, also the way, John, you were talking about the promises made to Afghanistan, and now what does that mean for women and girls in Afghanistan, and making some of those connections for people is really critical. Jean, we're running out of time, but this is so valuable. Jean-Martin, what recommendations are the report making to avert the looming crisis? What would you add?
Look, I totally subscribe to what was said on prevention of these crises and preventative approaches being very important at the present time. Collaboration being a key thing. So, Jeanette, thank you for bringing that out. Innovation as well. I would like to conclude on the importance of safeguarding the data from these places where we work in. Data and analytics, they're the collective GPS of our community. And when we don't have a GPS, we get into trouble. And I think we've all made the experience driving and getting lost. Well, this is what could happen to us if we don't keep the data flowing in the humanitarian space. I'm not saying spend just as much as you did. We need to find innovative ways. We need to collaborate. We need to prioritize our data collection. But let's keep the data flowing and ensuring that we have the right information to assess these impacts and keep headed in the right direction. That would really be my call right now. Safeguard information systems. Thanks, Paul.
Thank you, Jean-Martin. Look, I'm conscious of the richness in this conversation. We wanted to keep this crisp and really encourage you to find out more and to dig into the reports and the work that's being done by each of the organizations and teams represented here. We will be sharing a recording, and we'll be sharing also some details. We'll put in all the links and things. And if there are further questions, we will look at how we can answer them in some form. But we are running out of time, and I just want to sort of add a little bit of a close. You know, we have heard alarming figures. We've heard stories of young women, of children that are doing their best in a very tough environment to try and respond, to care for their families, and going to look for help in places where it has been in the past, and now finding those doors closed. And this is the human cost of a system which is under pressure, that's facing challenges like it's not seen in a long time. And I think, you know, this food crisis is really radiating across all aspects of life. And we need to think about the long-term impacts. And there's been some comments about how we've got to connect the humanitarian, the development, the save lives with the building resilience, the securing the future. We need to think about that in amongst these enormous setbacks, particularly for women and girls. And if we don't work fast, we'll lose decades of work and progress in many places, and we'll abandon some of the effective prevention and resilience strategies, maybe to deal with some of the outcomes. And that is something that we need to be very careful of. We need to safeguard the data. We need to tell these human stories better, and to rethink how we're operating in these settings, to think creatively and innovate. We need stronger partnerships, and we need to work together across partners and put local leaders and actors in the driver's seat. We can learn from other global health models about pooling funding, about focusing on strengthening local systems. And I think we need to remember that hunger and malnutrition isn't just a tragedy, it's a failure of leadership. It's human-made, but so are the solutions. And we know with the right humanitarian and development investment and policies, we can turn the tide and break the cycle of crises. We head into the 16th of October, a week from today, where we're going to celebrate World Food Day, which seems an odd word, celebrate World Food Day, at a time where we need to really raise the alarm on the global food crisis. And we're all going to do that in different ways. I know I'm going to be recalling the story, John, that you've told of that woman that called in, and trying to think how to share those kinds of stories and others like them. We have a campaign called the Hungry for Action campaign, and it's civil society organizations and campaigners across climate, nutrition, debt, humanitarian and food systems. And we're calling for both urgent humanitarian action as well as the long-term systems change to save lives and build resilience. And we're asking people to share empty plates, asking people around the world to take a simple, powerful act, hold up an empty plate, and demand action around this. My colleague Adam will share some links in the chat just around some toolkits for that. There's lots of other opportunities to elevate malnutrition crisis in the coming months. There's the First Leaders Summit of the Global Alliance Against Hunger and Poverty in early November. There'll be also decision makers gathering for conversations on resilience building in COP30 at Mimbalem a few weeks later. The G20 summit hosted by South Africa, the Africa Development Fund's also seeing its 17th replenishment in early December. We've got to use these moments to also really tell these stories and to take the data that's been collected in this report, put it on the table, and really bring it to the right people in the right ways. We need to call on people to step up, to take coordinated action that saves lives now, but also builds resilience and secures the future. On behalf of the SDG2 Advocacy Hub, a big thanks to our speakers, Jean-Martin, Jeanette, John and Andrew, for your time and insights. Thank you also to our co-host, WFP, and thank you everyone for joining the dialogue. As I mentioned, we'll be sharing the assets from this, and please encourage somebody else to have a listen, to hear a bit more, or to read the report. So thank you everyone. We really appreciate you giving us the time today.